Hello, everyone. Thank you for joining us today at our virtual reality naloxone training simulation webinar. As many of you know, we are thrilled to partner with Walmart to present this unique virtual reality training experience. We initially launched this simulation back in February 2020 at CADCA's National Leadership Forum. We then engaged with many of our amazing coalitions to learn how our communities can host events using this technology. We had great initial feedback, including how to use this VR tool as a standalone awareness event, how to create a training around it, or add it to trainings that are already being held. To date, we've held over 15 virtual screening events. We've engaged thousands of participants, and we look forward to hosting more events in the coming year and engaging countless new participants. Tonight, we are thankful for you, our amazing CADCA members and guests. And we're specifically thankful to our very good friends and tonight's co-hosts, Marilee Fowler and the amazing team at MATFORCE. Before I kick this off to hear from our esteemed group of speakers, I want to let everyone know the goals for today. First, we will hear from a wonderful group of speakers here in Arizona who are working every day to save lives. We are honored for them to be part of this event. Then we will view a virtual reality simulation developed by Walmart that demonstrates a few different scenarios on how to recognize when an overdose is happening and how to administer naloxone. Lastly, we would love your valuable input while learning from you all in attendance today, how you might use this virtual reality format in your communities. From these events, we plan to learn how to use this technology to better save lives and create a norm that every life is worth saving. So again, we would love your valuable input. After we hear from our speakers and see the simulation, we'll have a few minutes for some guided Q&A. I'll ask a few questions at the end of the hour, and if you would please type your answers into the chat, we appreciate your input. Additionally, in the weeks to come, we will reach out to you as a group to get more input from you as well. Typically, our next speaker now is CADCA's President and CEO, General Barry L. Price. Unfortunately, he's not able to attend tonight's event. He did, however, want me to express his apologies for not being here and also thank you for the work and impactful collaborations you are achieving throughout the state of Arizona. In lieu of General Price, I'm pleased to introduce you and turn comments over to CADCA's Chief of Staff, Valentino Murphy. Valentino joined our team at CADCA almost a year ago and has jumped in with both feet. We're thrilled to have him on board and we appreciate him being here to speak with us today. I turn it to you, Valentino.
Thank you, Reiko. As you stated, I'm thrilled to be here tonight for this very important event. I would like to personally thank Walmart for their investment in not only this technology, but for their investment in the people who will benefit from this life-saving training. I'd like to extend a special thanks to our co-hosts, Marilee Fowler and the entire MATFORCE team, who have been great advocates and allies of CADCA for many years, including on our Coalition Advisory Committee. It's an honor to be on with them and other leaders from the great state of Arizona. I'd also like to thank everyone on today's webinar. We hope this unique event will train you on how state and local agencies are collaborating to combat the opioid epidemic in our communities. CADCA has a footprint in over 30 countries worldwide. We have more than 5,000 coalitions across the United States and nearly 40 in Arizona. We have sought to train community residents and leaders to build and develop coalitions in communities and reduce substance misuse by adapting CADCA's model for community change. We are now entering a hopeful and promising stage in the country. We are vaccinated, boosted, and committed to having life return to normal. We must use this energy, this new shot of life, to stay motivated and create innovative and groundbreaking strategies to address substance use. Today's webinar is a great example of that. CADCA knows that the prevention of substance use and misuse before it starts is the most cost-effective and cost-efficient way to reduce substance misuse. Prevention has become more important than ever. Recently, the CDC reported that over 107,000 drug overdose deaths occurred in the United States in the 12 months ending in December 2021. the largest number for a 12-month period ever recorded. To put it in perspective, that number would fill State Farm Stadium 1.5 times. This is tragic, and we have to do our level best to right this ship. As life returns to normal, it is important to work together as one nation, one goal, one CACA. One CACA is a call to action. It signals that the participants within this movement must unite and come together as one if we are to win. Together we are strong, and as we train substance use and misuse prevention to coalitions every day of the year, all across the world, we know that without the buy-in of leaders and community stakeholders such as yourselves, our desired end state will prove unachievable. You are the true heroes in your community. Let it be known, if you did not receive your medication from your licensed pharmacist, do not take it. We have seen what one pill laced with fentanyl can do, and we do not need to see any more lives lost. Keep up the great work that you are doing, and thank you for having me on today. I'll now turn it over to you, Reiko.
Thank you so much for those remarks, Valentino. We welcome you and appreciate you joining us tonight. And now it is my pleasure to introduce our first speaker. Dr. Sarah Salick has been the Chief Medical Officer for the Arizona Healthcare Cost Containment System, or ACCESS, since June of 2014. In her current role, Dr. Salick spearheads the agency's major clinical initiatives and oversees the quality and delivery of the healthcare services ACCESS provides. Clinical initiatives currently underway include the expansion of telehealth service delivery, improving child and adolescent preventative care rates, and addressing the opioid epidemic. Dr. Salick grew up in Tucson, Arizona, and graduated from the University of Arizona College of Medicine. She completed the Child and Adolescent Psychiatry Residency Training Program at Boston Children's Hospital through Harvard Medical School. We are so pleased to hear from her tonight.
Thank you so much for those introductions. I'm really honored to be here talking about ACCESS's strategies to address the opioid epidemic. Unfortunately, we have seen an impact with the COVID pandemic related to our opioid trends and opioid-related fatalities as provided through the Department of Health Services opioid dashboard, in that we've seen an increase in opioid-related overdoses since the start of the pandemic. And so now more than ever, it's critically important for us to implement those really effective strategies in preventing opioid-related overdose, including naloxone distribution. So I want to thank our community coalitions, as well as Marilee Fowler through MATFORCE for their leadership in saving lives across Arizona. You are making a difference, and we so appreciate you. And so I'll just provide a high-level overview around what your Arizona Medicaid agency is doing. And to that end, wanted to note that we're really unique in Arizona in that we've merged our Medicaid agency, which is the primary funder for substance use related services, as well as our state mental health and substance use authority, which oversees our federal block grants, including from SAMHSA, under one agency, ACCESS. And so I'm the Chief Medical Officer for ACCESS, and I help oversee many of our strategies to address the opioid epidemic. So just to get started and overview what those strategies are. First and foremost, I'm a firm believer in primary prevention. And so we've got multiple strategies that we're funding right now to target grade age students, including the PACS Good Behavior Game, which has been demonstrated in longitudinal studies to decrease substance-related conditions, including opioid use disorder later in life. And so thankfully, Department of Education is funding that now through intervening in schools, but we're also supporting that in funding it through our children's system of care. Additionally, we have multiple stigma reduction campaigns going on, including related to our pregnant women who have opioid-related conditions. And many of that is funded through our sister state agency, Department of Health Services, and as supported through our state opioid response grant. And then as you can see on this slide, and I can't repeat it enough, and I know as community coalition leaders, this is an absolutely a tool in your toolbox related to naloxone. And so I'll be spending a good portion of my segment around the importance of naloxone and how we have been able to get it out in the hands of individuals in our communities through multiple funding streams, including Medicaid, our substance abuse block grant, as well as our state opioid response grant. Additionally, our substance use practice strategies include practitioner education. And so we have, over the course of multiple years, really changed the needle on what this opioid epidemic looks like. So initially, there was a huge component around opioid prescribing from our practitioners based on specific laws passed here in Arizona, as well as a change in practice by our practitioners. We're really seeing a shift more towards use of illicit fentanyl and other opioids from the street. And so I think we've done a really good job around changing the practice of opioid prescribing, for example, for chronic pain or conditions where the risk of opioids don't outweigh the benefit. And last, but definitely not least, it's around improving our system of care, around identifying individuals who have or are at risk of opioid use disorder and navigating them to evidence-based treatment. And so we have implemented a lot of novel programs here in Arizona, including our 24/7 access point or centers of excellence for medication-assisted treatment, huge supporters of peer navigation, including where possible, implementing peer support in the emergency department and a warm handoff to one of those 24/7 centers. And then, of course, access to all available FDA-approved forms of medications to treat opioid use disorder. And so digging in a little bit more, and again, specifically around naloxone, I first want to give a shout out to Arizona. We were highlighted in a internationally recognized peer-reviewed published journal, The Lancet, in their public health section in 2022. So this is in February of 2022, and you can see on this slide is referencing this specific article, which is named Estimating Naloxone Need in the USA Across Fentanyl, Heroin, and Prescription Opioid Epidemics, a Modeling Study. And I'm tooting our horn a little bit here in Arizona because we were the only state to achieve a target naloxone use of in 80% of witness overdoses. And that in large part is secondary to the work that we funded through our substance abuse block grant, through community-based naloxone distribution, through Sonoran Prevention Works. And I'll go through a little bit more of what that data trend looks like around naloxone and the volume of naloxone that is getting into the hands of Arizonans in my last slide. And then I also wanted to make you all aware of a really cool services locator. It's on the Access website, and we funded it through our state opioid response grant. And it basically helps navigate our community members to treatment. And so you can search by zip code and find, medication-assisted treatment, for example. You can also find, and this is something I wanted to make sure you were all aware of, who's distributing naloxone. And so we have a naloxone distributor locator as well on our website. So if you haven't had a chance, please check it out and spread the word because it's one form of information that we can get out to our communities to let them know where to get naloxone in the communities, apart from all of you that are distributing it through your local coalitions. I also wanted to recognize our Substance Abuse Coalition leaders of Arizona, SACLA AZ, including, as I mentioned, Mary Lee Fowler and her leadership in really organizing and empowering MATFORCE, but also serving as a leader for other community coalitions in regards to how do you really form and develop and sustain a coalition? Because I can't say this enough, but our coalitions are getting the job done. And so the more that you do, the more effect it has in your local community. And so you are making a difference, you are saving lives. And so SACLA AZ, in support from our state opioid response grant, actually provided and developed a naloxone training kit. And this next slide demonstrates some of those distribution materials that can be used in your local communities to make sure that people are aware around what naloxone is and that it can save lives, including the lives of our family, friends, and our community members. And then last but not least, I wanted to provide an overview of what the data is telling us related to naloxone distribution by year. And so on this slide, you'll see the count of naloxone doses based on funding sources by year. And so the yellow line is the amount of naloxone that's being prescribed and reimbursed through Medicaid. So it's the minority of naloxone that is getting out there. So for example, it's when a practitioner such as myself prescribes naloxone and the member's family gets it filled through the Medicaid pharmacy benefit at the local pharmacy. So we know a lot of our Arizonans are not going to access the medical system for a variety of reasons. And so that's why we really are supplementing our naloxone distribution efforts with both a community-based distribution through Sonoran Prevention Works, which is currently Access's vendor, and they were awarded the procurement for our community-based distribution model, but also through our community coalitions as well as law enforcement, which is that red line. And so the blue line is the community-based distribution, and that has been our primary source of naloxone distribution, as you can see by those blue line numbers. But one thing that I wanted to note, and it is a pretty significant jump, is between federal fiscal year 20 and federal fiscal year 21, you can see that red line. We went from 56,162 doses to 156,354. So that's over 100,000 doses of naloxone that we've increased between 20 and 21. And that's in large part due to our community coalition. So a huge shout out and thank you for doing what you're doing. Again, you're making a difference in saving Arizonan lives. So keep getting the word out there, keep spreading naloxone, including the information as well as the medication itself. We so appreciate you from the access perspective.
Thank you so much, Dr. Salek, for taking the time to be part of this event and explaining all of the amazing work you guys are doing in Arizona and the amazing resources that you have there as well. And thank you for everything you do every day for the state of Arizona and for our communities. Next, we will hear from Sheila Polk from the county attorney from Yavapai County. After completing clerkship at the Arizona Supreme Court, Ms. Polk worked in the Arizona Attorney General's office for 11 years before moving to Prescott in 1994. There, she joined the Yavapai County Attorney's Office, where she specialized in the prosecution of felony crimes, including elder abuse, sexual offenses, and repeat felony offenders. First elected in 2000, Ms. Polk is currently serving her 6th term as county attorney. In addition to overseeing a staff of 114 employees, Ms. Polk has found time to be at the forefront of change. She chairs the Arizona Prosecuting Attorneys Advisory Council, the Arizona Criminal Justice Commission, and the Governor's Arizona Substance Abuse Partnership. She is chair and founding member of MATFORCE, the Yavapai County Substance Abuse Coalition, and serves as an advisory council member for the Yavapai County Justice and Mental Health Coalition. In 2012, she was awarded the prestigious Michael C. Kude Criminal Justice Award from the Arizona State Bar. Ms. Polk is the driving stimulus behind the nationally renowned law enforcement course, What You Do Matters, Lessons from the Holocaust. In 2018, the United States Holocaust Memorial Museum recognized Ms. Polk at a national tribute dinner in Washington, D.C., and the Arizona Prosecuting Attorneys Association awarded Ms. Polk with the Gerda and Kurt Klein Guardian of Freedom Award for her tireless efforts to teach the lessons from the Holocaust to police officers and prosecutors across the nation. Most recently, Sheila was honored as an outstanding Arizona State alumni in 2019. We're excited to hear from you tonight, Sheila, and we look forward to your insights.
Hi, my name is Sheila Polk, and I serve as the Yavapai County Attorney. It's a position I have held for the last 21 years. I want to talk about community-based substance abuse coalitions because I am just a fervent believer in the difference that coalitions can make in a community. We formed MATFORCE, the Yavapai County Substance Abuse Coalition, in 2006. We came together over the realization that law enforcement alone cannot solve a community substance abuse problem. And so we invited everyone to the table and asked everyone to be part of the solutions. And of course, solutions are always multi-pronged, which is the magic of substance abuse coalitions. They are at the forefront of change. They're at the forefront of what is trending, and they are especially positioned to take action immediately if they see something happening in the community. I think that is so true when we talk about the opioid epidemic and naloxone in particular. MATFORCE has been at the forefront of efforts to, number one, raise awareness about this terrible epidemic, and number two, to make sure that naloxone is available throughout our county to anyone and everyone who has the ability to carry it and who is willing to administer it. In fact, MATFORCE has also been at the forefront of offering trainings at the local level on how to use naloxone and how to use naloxone effectively to save lives. Finally, at MATFORCE, we put a lot of emphasis on support for people who are in recovery. Naloxone is one important tool in saving lives, but equally important is the support that we build around individuals who are suffering from substance abuse. And so MATFORCE offers a lot of programs on substance abuse education. We offer a program called Yavapai Reentry, working with inmates who are leaving prison and coming back to our community. The focus at MATFORCE always is to build healthy communities and to work together to solve a community substance abuse problem. Thank you for letting me be part of this video.
Thank you, Sheila. Your reminder of the value of community coalitions is such a vital message, and they truly are, as you say, at the forefront. Now we will turn it over to our partner in organizing tonight's event, Marilee Fowler, Executive Director of MATFORCE for the past 15 years. She is also the Executive Director of the nonprofit organization Community Counts. Marilee is an appointed member of the Governor's Arizona Substance Abuse Partnership. She was key to forming the Substance Abuse Coalition Leaders of Arizona and serves on CADCA's Coalition Advisory Committee. She's a passionate, action-oriented preventionist with local, state, and national influence. Under Marilee's leadership, MATFORCE has been awarded 7 national awards, including the 2013 Coalition of the Year. She was selected as the 2015 Chris Bell recipient from Arizonians for prevention for her work in prevention. In 2018, Marilee was honored as an Outstanding Director of the Year for the state of Arizona by the Organization of Nonprofit Executives and received an Excellence in Prevention Award from the Arizona Department of Liquor Control. Most recently, Marilee was the recipient of the 2021 Outstanding Public Health and Public Safety Collaborative Effort Award from HIDA. We're so excited every time we get to work together with you, Marilee, and we're inspired by your contribution to prevention coalitions everywhere. I turn it to you.
I want to start this evening by thanking CADCA for this amazing opportunity to educate our community on naloxone. I have had the honor of being a member of CADCA since I started working for MATFORCE in 2007. And I can truly say it's the reason that I've learned the art of being a prevention specialist and how to run an excellent coalition. And I've had the honor of running the Excellent Coalition of MATFORCE for the last 15 years. MATFORCE is a coalition of people from all over, all different sectors of our community that work together to meet the goal of reducing substance use in our county. It's amazing to see the progress that can happen when we all take off our individual hats and work collectively toward that goal. The beauty of MATFORCE is people come up with very creative ideas on how we can address this very complicated problem. And CADCA has been our partner all along the way. For the last several years, as we've looked at the opioid problem, we've had to get real creative on how we can address this very complicated problem. We've done many different strategies, first starting with the prescription drug problem, then it moving into a heroin problem in community, and now as a fentanyl problem in our community. We have worked for the last several years addressing the illicit counterfeit fentanyl pills that are causing a majority of the overdose deaths in our community. We also realized the importance of working together as a state to address this problem. In 2018, I made the decision to form the Substance Abuse Coalition Leaders of Arizona. And it has been really wonderful to see what 30 coalitions working together can accomplish. We were very thankful to the state of Arizona in 2020 when they decided to award SACLA, State Opioid Response Funding, to implement the fentanyl toolkit. I encourage anyone listening today to access the fentanyl toolkit at sacla.org. There are many wonderful tools. There are print materials. There are PowerPoint presentations that people can do. There are radio and TV commercials that we are running statewide. There are billboard messages, lots of takeaways for community members. There's social media messages that people can access. We also realized when we were educating on fentanyl, the importance of educating on naloxone. And so in that toolkit, there are many different tools on educating with naloxone. Again, print materials, how to use naloxone, how to identify an overdose death, and a PowerPoint presentation if you would have the opportunity to present this important information to others. We're so grateful for the drug naloxone. We have seen it save many, many lives in our community. And a great success of MATFORCE right now is for the first time in the last 6 years of us tracking overdose deaths from 2020 to 2021, we actually had a decrease in overdose deaths. We see that these strategies are working because when we look at this 11% reduction in overdose deaths, at the same time, the state is seeing an increase and our nation is still seeing an increase. So we know that the strategies and education that we are doing is making a difference. We hope that you'll enjoy the information presented this evening and take away some tools that you can use in your own personal life or in your organization.
Thank you so much, Marilee, for being with us tonight, for being our co-host, and for the amazing work you have spearheaded with Substance Abuse Coalition Leaders of Arizona. We know it's just these types of resources that empower community members to be change makers. Now we turn to hear from Amy Neville. Since losing her son, Alexander, to overdose from counterfeit prescription pills, Amy has dedicated her life to educating and spreading awareness of threats on our children. Amy's mission is to shed light on this issue and advocate for change. In the last year, she has met with students, school counselors, school boards, PTA, scout troops, DEA agents, prosecutors, every county sheriff in Southern California, state and federal politicians, and many more to share and learn what we can do to help. Amy is a tireless crusader and shares the message of hope for our ability to achieve change.
My name is Amy Neville. I'm the president and founder of the Alexander Neville Foundation. Our mission is to educate and spread awareness about opioids, especially fentanyl. Adolescents are particularly vulnerable to fentanyl poisoning. With our peer-to-peer prevention program developed by youth, we focus on giving adolescents the knowledge and tools they need to make healthy decisions and to be prepared for anything. The Alexander Neville Foundation was created in honor of my son, Alexander, who died from fentanyl poisoning in June of 2020. He was a newly turned 14-year-old, getting ready for high school. He was a brilliant student and had a curious mind. This led him to explore, and he began experimenting with cannabis. The night before he died, he told us he had been taking OxyContin for more than a week. It had a hold on him, and he didn't understand why. He came to us with a plan. He wanted to go into treatment as soon as possible. That next morning, we started making calls. Later that night, he got home from hanging out with friends and consumed a pill that he believed was to be OxyContin. That one pill contained enough fentanyl to kill 4 people. It turns out that most, if not all, illicitly obtained pills are made of fentanyl. They're pressed to look like trusted pharmaceutical drugs, but they are all fentanyl. Besides the issue of the major addictiveness of fentanyl, the problem is that the producers can unintentionally create pills that kill. Alex took one. And so have tens of thousands of other young adults, adolescents, moms, dads, your neighbors, your cousins, you name it. Today, of the 107,000 drug deaths in 2021, fentanyl was involved in almost 70%. That number has been growing for more than 10 years and has shown no sign of slowing. Today, the Alexander Neville Foundation is working to lower those numbers by teaching families one person at a time, one school at a time, one public service announcement at a time, or whatever is necessary to spread the message that this harm is out there and that we need to stop this crisis. We tend to hone in on stigma when teaching about counterfeits and drug use. The statistics show that most of us know someone who is using, so it's important to embrace this issue. We can't afford to stigmatize and shame people or families that need help. Even those without addiction try drugs and make mistakes. Everyone needs to be ready to help. The Alexander Neville Foundation has built relationships with communities, schools, law enforcement, and policymakers to advocate for change. We are working with adolescents directly to create networks for youth, reaching out to other youth. Adolescents tend to influence each other more than parents and random adults, so this undervalued resource needs to be encouraged a lot. Besides better knowledge and community resources, naloxone is a tool that we distribute, encourage people to keep on hand. We tell people the best way to be prepared is to keep naloxone in their home, classroom, backpack, every first aid kit. It's simple, and with Good Samaritan laws, we teach that everyone should be prepared to help their friends or family who may be affected by fentanyl. Today, the fentanyl crisis is still growing, and it's likely you know someone who has been impacted by it. This issue is not just for those with substance abuse challenges. This is an everybody problem. If you don't know anyone yet who has died of a drug overdose or drug poisoning, you soon will.
Thank you, Amy, for sharing your story with us and for the work you're doing every day to help educate and keep our youth safe. We thank you for being here with us tonight. Our final guest speaker tonight is Maddie Lattin. Maddie currently serves as program assistant for MATFORCE, helping lead their efforts on the Yavapai Reentry Project. With this project, Maddie helps formerly incarcerated individuals overcome social and emotional barriers resulting from their past through support, encouragement, and relationship building. She teaches project participants through their own personal experience and professional knowledge, giving them a sense of place in the community and giving them an opportunity to grow and improve. Maddie is celebrating 5 years in recovery from addiction and is passionate about substance abuse education and prevention. She's heavily involved in the recovery community and knows several individuals whose lives have been saved by naloxone. We turn it to you, Maddie.
As a person who is in recovery from drug addiction, who has been clean for over 5 years, I feel greatly personally moved by overdose awareness. Not only was I somebody who could have been a victim of my drug use and not made it to be speaking today, but I know a number of people personally, friends in my life, family in my life, who've been affected by the opioid epidemic. What comes to mind is a friend of mine who was in active opioid addiction and was using with a few other addicts, and she started to overdose on such a small amount of drugs, or seemingly small amount of drugs. And she had to have naloxone administered 5 times for her to come back. She was almost gone, and that's terrifying to me, that such a split second could change everything forever. I know her to be such a bright, warm, wonderful person, and I'm so grateful that she's still here today. I work with addicts in my professional field, and often they come in traumatized, just not in their right minds, and that drives their drug use. But after spending time with them and helping them get clean, and helping support them, I get to see these individuals blossom into wonderful people that I'm proud to know. They all bring so many different attributes, characteristics, and perspectives to the table. And to think that they could possibly not even have this second chance at a different life without a life-saving medication, it's just mind-blowing to me. Mind-blowing to me that everybody underneath their addiction is beautiful and wonderful and amazing in their own way, and without things like naloxone and other medications, I wouldn't know that, or we wouldn't know that. And I think it's important to understand the dangers of the drugs that we have in our community today, and the fact that just such a small amount can end someone's life forever, and we'll never know what sort of college classes they ended up wanting to take, or whether they, finally got that painting finished that they were working on forever. There's a couple instances that come to mind where I am just so grateful that I got to see them through to the other side.
Thank you, Maddie. You remind us all that each one of our community members is a gift, and your work strengthening and sharing with others is so central and so important to healing our communities. Thank you so much for being with us. Thank you to all of the speakers who are here tonight. And before we move on to the VR portion of this webinar, both Marilee and Sarah mentioned the fentanyl naloxone toolkit. You can access this at sacla.org or talknowaz.com. And here's a short video, which is just an example of some of the resources that are available on this site.
Isaiah was 15. He was in the middle of his sophomore year in high school. He just had this light about him. I get notification from a family member that there's a picture of Isaiah passed out. They're saying that he took a pill. You know, he went to go lay down and he just wouldn't get back up. We're pretty sure that your son ingested fentanyl, and they're telling me he's not gonna make it. And I just told him, like, I love you no matter what. And you didn't deserve this.
Learn more at talknowaz.com.
Thank you again, Marilee, for sharing all of your amazing resources with us. Please remember to visit talknowaz.com to learn more. And thank you to all of our speakers tonight. They're truly inspiring and doing incredible things in our communities. And now we will view the virtual reality simulation portion of this event. Walmart has invested in training their associates, which includes the use of VR with virtual reality. The VR program was developed as a tool for training that was designed to help replicate unique training situations that are hard to replicate in a classroom setting, such as Black Friday trainings and simulations. This technology led to the development of non-retail training, such as the VR we will see next. So let's take a moment to review this training.
Dude, guess what I just swiped for my grandma?
What? Don't people get strung out on this stuff?
Yeah, that's the point. Come on.
I've heard.
These two industrious young gentlemen have stolen opioid medication for recreational use. Oxycodone, hydrocodone, fentanyl, and heroin are a group of chemicals referred to as opioids. The first three may be prescribed by a medical professional to treat pain, but they can be addictive and deadly, especially if not taken as directed. Heroin has no legitimate medical purpose. Opioid overdose is the current leading cause of death for people under 55. True or false? More than half of Americans have been affected by opioids. Correct. Over 70,000 people died of opioid overdose in the United States in 2017, and millions more were impacted through overdose or misuse. That means that if you have not been directly affected by opioids, someone you know likely has. But not every overdose needs to end in death. Today we're going to teach you to spot the signs of an overdose and administer naloxone, a life-saving medication.
Hey. You okay, dude? You don't look so good.
Opioid overdoses will slow or stop your breathing. This reduces the amount of oxygen in your body, resulting in pale or clammy skin. The pupils will constrict until they are the size of a pin. The lack of oxygen can cause the fingers and sometimes lips to turn blue, gray, or purple, depending on the person's skin tone.
Dude, your breathing is weird. It's too slow.
A very serious side effect of opioids is depressed breathing. During an overdose, their breathing will become shallow, erratic, or stop entirely.
Yo, Jay. Jay. Wake up, man. Wake up or I'm calling the cops. John. Hey, I'm not playing with you. Are you breathing? Dude, you're not breathing. Jonathan.
Loss of consciousness is the final tell of an overdose. If you suspect someone is passing out because of an overdose, you should scream their name and try to wake them to see if they will respond. As with any emergency, the first thing you should do is call 911.
911, what's the emergency?
Yeah, hello? I need help.
Naloxone is a life-saving medication that can reverse opioid overdose and restore breathing. There are several types of naloxone available, and all of them provide a life-saving medication in the event of an opioid overdose. In the example today, you'll see the nasal spray Narcan administered. If you happen to have the injectable form, make sure to hold the needle straight and inject it into a muscle, like the shoulder or the upper thigh. First, peel back the packaging to remove the device. The device has a plunger and a nozzle. Hold the device with your thumb on the plunger and 2 fingers on the nozzle. Be careful not to accidentally spray the naloxone before you are ready. The device only has 1 dose, so don't test it out. Put the device right up their nostril until your fingers are touching their nose. Press firmly on the plunger to release the dose of naloxone.
Come on, buddy. Wake up. Come on, man, wake up.
After you administer naloxone, place them in the recovery position and wait for help. The person who overdosed needs immediate medical care. You should stay with them until help arrives in case they lose consciousness again. Another dose may be necessary.
There you go. There you go. All right, that's it. Welcome back.
Great job. When people think of overdose, they usually think of recreational opioid use like we saw here. This is a stereotype, and unfortunately, there are many situations that lead to accidental overdose. Let's take a look at other situations that can lead to accidental overdose.
Mom? 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 Mom, wake up. Mom? Not again. My mother is blacked out. I think she's had a heart attack. Send an ambulance.
Please stay calm. I'm going to check her vitals. What's her name?
Blanche.
Blanche, I'm here to help you, okay? Is that hers? I'm going to check her for an overdose. She's got a pulse, but her breathing is slow. Let's check her pupils. All right, stay with me. Uh-oh, they're constricted. With this medication, this may be an overdose. Let's administer naloxone. All right, Blanche, stick with me, okay? 1 second. All right, I'm just gonna go right up here. The patient took too much of her prescribed medication. She forgot that she took her medication before breakfast and took another dose after breakfast. In the event that this had been a heart attack, naloxone wouldn't have been able to treat the heart attack, but it would generally be fine to administer to her without serious complications. Talk to your healthcare provider or check the package insert for possible side effects and additional information. All right, Eugene, got your stuff. Oh no. Eugene took an old opioid medication that he had previously been prescribed for pain. Usually this wouldn't cause an overdose, but he's taking a new benzodiazepine medication. When opioids and benzodiazepines mix, the results can be deadly. Always check with your doctor or pharmacist before taking any medication, just in case there will be a negative interaction with your other medications.
Sending an ambulance right away.
Opioid overdose can happen to anyone. You can overdose from opioids even when taking a prescription exactly as your doctor prescribed, which is exactly what happened to me. All right, hotshot. I hope you're paying attention. It's your time to shine. Select the things you should look for when you suspect an opioid overdose. Now, let's review how to administer naloxone. Correct. You have to remove the device from its packaging. It will not do you a lot of good otherwise. Correct. That's how you hold the device. That's correct. You did it. You saved my life. Thank you for knowing what to do in the event of an opioid overdose. Accidental overdose can happen to anyone taking opioids, whether recreationally or even as directed by a doctor. This information can save a life. Opioid misuse is a national epidemic, and accidental overdose can happen to anyone taking opioids. It takes an entire community to keep all our members safe from overdose. If you or someone you care about is taking opioids for any reason, consider getting naloxone at your local pharmacy and keeping it on you at all times. No prescription is required, and it could save your life or the life of someone you care about.
Thank you so much to the Walmart team for developing this powerful tool. We are just thrilled to be working with you to connect this to community members. And again, thank you to all of the speakers here today who have taken time out of their schedules to be part of this event. I want to be really respectful of everybody's time. We have really about 5 minutes left, and we were hoping that we could get some feedback, just some quick Q&A. If you guys would respond by putting some of your feedback into the chat, we are monitoring it. Please know that you can reach out to us at any time with any more feedback that you have or anything that you'd like to let us know. We will be putting our email addresses in the chat as well. So I think just a couple of things that we wanted to touch on is when we're thinking about training and awareness events and creating sort of that norm that everyone should have naloxone and everyone should know how to use it. What training sites or groups do you think need trainings like this the most, and who might be the most interested? And some of the feedback that we've had before have been local high schools, college students, 4-H clubs, we've really heard casinos, even small businesses. Thank you. College orientations, education professionals. That's great. Summer camps. Individuals in recovery. I mean, absolutely. Anything else? Those are all fantastic. Are there events that, middle schools? Yes, middle schools. Thank you, Laura. Are there events or local efforts that you're aware of that really we could be going to where we can engage more people in education and trainings like this? And we've gotten a lot of feedback, like county and state fairs and church events, take back events, small businesses, after school clubs. Yeah, farmers market, back to school nights. Thank you so much. That's such great feedback, and we're taking all of that. Okay. I think just really my last question would be, where are the gaps in your communities? Not just where can we educate employee groups? Thank you, Marilee. So where are the gaps in your communities? Not just where can we educate and train more individuals who need to know about naloxone and need to know how to use it. But we'd also love to know, are there people in your community who need naloxone but can't access it or don't have enough of supply of it? And we've had, for example, heard things, like fire departments and shelters don't have access to it. And how can we be helpful learning about those sort of gaps in the community? Parks and Recreation. Great. Well, you guys are just amazing, and we want to thank you so much for educate employees perhaps on their lunch. Oh, that's a great idea. Sober living homes, senior centers, definitely. We've heard a lot about that, and really think that's a great idea. Okay. So thank you. So we are now through the hour, and we really want to extend our thanks to all of our speakers and participants for attending this event. We truly appreciate your time and insight. Please reach out to us at CADCA anytime with more suggestions and questions, and look for us to be reaching out to you. My name is Reiko Mendoza. You can reach me at rmendoza@cadca.org. And I know they'll put that into the chat for those of you who don't know me or any of us at CADCA. We really want to thank MATFORCE and Marilee, as well as Walmart, and again, to everyone who've attended. We appreciate your time. We appreciate the amazing work that you're doing in your communities every day. We will now conclude the webinar, and we wish you a great rest of the week and a great weekend. Thank you so much for joining us.